Easily find, book, and manage your travel nursing assignments with the AMN Passport app. Download today. When you started as a nurse practitioner and started seeing, like, going to people's homes and seeing the wounds that you were, like, kind of experiencing these wounds, like, on the fly, or like did you get to see like the worst wounds like when you were in it,
Oh
and
my gosh. Yes. So,
yeah.
like as a new grad, I'm just happy that the company that I work for is very supportive. So we always have someone to call right away. I'm like, hey, I have this wound. I have no idea what to do with this.
That's
We
good.
always have that. But can I talk about the worst wound that I've
Y-
ever encountered?
Please.
Oh my gosh. It was the craziest thing. So I'm like there, I think I was covered. I think someone transferred this patient to me. I'm like, okay, cool. And then I go to that patient's house and I remember the husband was like, oh hey, like welcome. And he said something like, there's a lot of flies here. Like that.
Oh
Like
no.
just like ran, there's a lot of flies here. I'm like, all right, cool. And I didn't
No.
even think about it.
Yeah, right.
I'm like, I'm like, okay, that's all right. And I go inside there, I see the patient, and I'm like, what do I do? Like, I'm opening the gauze, I'm opening it. Next thing I
Close your
know,
mouth.
oh my gosh, there's little maggots there. And
Oh
oh
no.
my gosh,
Not
I
medical
think
maggots.
not
Real
medical Maya,
maggots.
real ones,
Yeah.
okay?
Oh
And
no.
and for me, I've never seen like maggots like in a wound ever. That's like a you see that like once in a blue moon, right? So to experience that, I'm like, wow. And as a clinician, right, you're the only one there. Like no one else is
Yeah.
gonna help you.
You
No
gotta
one
keep
else is
your
gonna.
clinician face on.
Yeah. So I had to like, okay,
Swallow.
all right. But in that area, I was like, my heart was like beating. I was like, oh my gosh, like how am I gonna do this? Like,
Yeah, like how do you
oh.
get them out? Like how so what did you do?
So I mean I tried my best. I tried my best to like wipe that wound and I was really trying to clean it and trying to keep the family member calm. Okay.
Yeah.
And then that was the thing. And I remember she also was saying something like, yeah, I felt something like scratching me. I wasn't sure what it was, and I was like, okay, all right. But I try to clean it as much as I can. And then when I called the case manager, I was like, hey, I want a daily, like I want this dressing change daily to make sure that
Yeah.
everything.
Those
But
don't come back.
yeah, but after that, oh my gosh, her wound looks so it's like beautiful,
Oh,
because like
good.
it cleans it, right? So I was
Well,
like, wow,
yeah. That's like, I mean, like we use medical maggots. That's like and they're expensive. I remember
yeah.
I had a patient inpatient once, and well, a couple times I've had patients with maggots, and it's always weird. I mean, wound is always the one to like do those dressings because like they like want you to count like each one. Like they want to make
Yeah.
sure that they like have them all, they're all accounted for. And I remember there
Yeah.
was this one guy, and he had some like severe developmental delay. He was a total care, and he had a really bad wound on his hip that we were using medical maggots for. And he
Mm.
was a quad essentially, except for his left arm. He could move his left arm. And he was like positioned just so. I think he was like in a waterbed, but
Oh man.
I had him with his like left hip up, and his left arm is the only one that he could like really, move. And I went in there, and he had like gotten his arm over the hip, and he had like pulled the dressing away, and just maggots were like in the sand
Oh
bed,
man.
like in all. I had to suck them out with a suction canister tubing. Like it was because they wanted all of them. I'm like this, and I'm sure it was like 8 in the morning. Like I had just gotten
Yeah.
there. Like
Oh man.
just